Hello everyone, welcome to my YouTube channel. I want to answer a question that someone was asked when he or she went for American Society for Clinical Pathology exam. All right, so let's look at the question. The question said a patient has an anti-E alloantibody. A patient has an anti-E, that's big E, by the way, alloantibody. What blood should be selected? All right. Okay, before we continue, my name is Dr. Emmanuel Obodo. I'm a biomedical scientist, and I'm also a lecturer in biomedical science here in the United Kingdom. So let's dive into this question and answer, okay? Right, but before I continue, I think I've mentioned it many times that even though we're talking about American Society for Pathology exam, I want you to also know that this question can be asked anywhere, whether you are attending a biomedical scientist interview, a question or interview, or whether you are doing a medical laboratory scientist interview or medical laboratory technology interview. It's all about pathology diagnosis. So I would want us to pay attention to what this is referring to. Okay, so let me, just for a perfect understanding, let's go back to the question again. A patient has an anti-big E. A patient has an anti-big E alloantibody. Okay, what blood should be selected? Now, this question is very kind enough to let us know that this anti-big E is alloantibody. In other words, it is acquired antibody. It is not auto-antibody. It is acquired antibody. And when it is acquired, it then means technically that the person does not have antigen big E. A patient has an anti-big E alloantibody. Okay, so if patient has got anti-big E alloantibody, it means that the patient developed it. And if the patient developed it, it then means that the person does not have the antigen. Okay, because most times biomedical scientists will tend to mistake this antibody and antigen. They are two different things. So when you talk about antibody, you are talking about a response based on antigen that is present. Okay, now when you say antigen is a kind of the chemical composition or protein composition of an organism. So antigen talk about an organism or a cell, or as the case may be. Okay, but when you say antibody, it is something that was triggered based on antigen, and that trigger can be based whether the antigen is foreign, that means known or unknown to the patient. Does that make sense? So when we say alloantibody, it means the person developed that antibody. Anti-big E is different from antigen big E. They are not the same. Okay, anti-big E can be a response of exposure of antigen big E. In other words, if somebody developed anti-big E, it then means the person does not have the antigen big E. And that is why when the person develops antigen big E, it means that the person has been exposed to a foreign antigen, which on this occasion is antigen big E. So when that antigen big E comes to the patient system don't understand this, and therefore the patient system had to respond, and that response will produce anti-big E. I hope that makes sense. Okay, all right, so a patient has anti-big E alloantibody. What blood should be selected? Now let me tell you why I had to lay that foundation. I laid that foundation because if you understand that this patient is developing anti-big E because he or she does not have antigen big E, then when you have identified that alloantibig E, you then need to go and select a blood that is consistent with the patient's system. So if the patient does not have antigen big E, and that was why the person developed antibody big E, if you are going to select blood, then you have to select antigen big E, negative. I didn't say antibody. Antigen big E negative, because the person does not have antigen big E. That was why the person developed the antibody in the first place. So now we've identified that this person has developed anti-big E, which means the person doesn't have the antigen. That means we have to go and select a blood that is antigen big E negative. Okay, so for example, if this patient is blood group O negative and has developed this anti-big E alloantibody, you can select blood group O negative antigen big E negative. If it is blood group O positive, you say, I'm going to select blood group O positive antigen big E negative. Likewise, other group, whether B or A or AB, as the case may be, what you're going to do, you select the group specific, and the antigen must be that antibody negative. In other words, antigen big E negative. I hope that makes sense. All right, I want to believe it makes sense. So let's go back to this question, then I'll answer the question. He said, I've already answered it, by the way. He said, a patient has anti-big E alloantibody. So what blood should be selected? So you are working in blood bank. You've identified that a patient has anti-big E, and you want to cross-match blood for this person. What blood are you going to select? A, he said, are you going to select E positive cross-match compatible? E positive cross-match compatible. In other words, are you going to select antigen big E positive, then cross-match it and like if compatible? Or are you going to select antigen big E, say big E, he said, he just said E negative cross-match compatible, okay? Then he said any ROH negative. He said this E positive type specific. Let me repeat it. A, E positive cross-match compatible. Is that what you're going to do? B, E negative cross-match compatible. Is that what you're going to do? C, any ROH negative. Is that what you're going to do? Or D, or D, E positive type specific. I've already told you the answer. The answer will be B, which is what? E negative cross-match compatible. Now, let me say something a little bit here. Even though we have identified the antibody and it is big E, and we are going to select antigen big E, for us to issue that blood, we must do a cross-match. In fact, let me put it this way. Once there is a history of antibody, or DAT is positive, or there is no current group, once there is any of this for you to issue the blood, of course, if is allowed, like if it is not an emergency, as the case may be, okay, for you to issue a blood, you must do a serological cross-match. Okay, so you can't say because you've identified the antibody, you're going to select antigen big E and do electronic issue. Anyway, the system will not allow you in the first place, but that is not allowed. So once antibody is identified, or there's a history of antibody, for you to issue any blood product to that patient, you must do a serological cross-match. So now that was why it's a E negative cross-match compatible, because it will surprise you that if you still get E positive, it may still be compatible, but that is not ideal, because you had already known that this patient does not have antigen big E. You don't have to secondary expose another antigen big E positive to that patient. Does that make sense? Right? Okay, so let's answer this question. A patient has an anti-big E alloantibody. What blood should be selected? A, is it E positive cross-match compatible? No, because we already know the patient is antigen big E negative. That was why the patient developed the anti-big E antibody. Okay, so therefore we are not going to select E positive cross-match compatible. Even if it is compatible, we are not going to select that should not be given to that patient. Okay, right? The B, E negative cross-match compatible. That is the answer. We are going to select antigen big E negative and cross-match it. Of course, if compatible, then we'll give it. C is a ROH negative. Okay, now that is not what we are going to do, but let me explain something a little bit here. When we say ROH negative, so remember, when we talk about antibodies, I don't know how I can explain, but when we talk about antibodies, they are belongs into different families. So you have ROH family antigens or antibody, as the case may be. Then you have other antigen antibody like MNS, okay, is a family, or you have Kel, okay, or you have Duffy, or you have kiddies, okay, we'll call it kiddies, okay. So when you say arrow, for example, if you say Kel, you're talking about BK or small k. When you say kiddies, you're talking about JK or JKB. When you talk about Duffy, you're talking about Duffy A or Duffy B. When you say MNS, you're looking at antigen or antibody, big M, antigen antibody M, N, or big S or small s. That is MNS. Now, when you say arrowhead, okay, that arrowhead antigen or antibody are now talking about big C, small c, big E, small e, then it's even talking about CW and of course D as well, okay? So these are arrowheads. Anyway, that is not the answer, even though that it is covering even the one we are talking about, okay? Because if you select any, no, it can't be any, because if you say any, that is wrong, okay? Now, perhaps what would be better is to select all the arrowhead negative, but what if you don't have it? Anyway, so the point is that for the fact you say any, that is not right, because any could be, you could select D negative only, you could select big C negative only. No, what your focus should be is on E, okay? So the any arrowhead negative is not the answer, but the reason why I explained this further was to show you that arrowhead antigen or antibodies are looking at big C, big E, small e, CW, and D. That's arrowhead antigen or antibody, okay? Now, these say E positive time specific. No, that is not what we're going to do, okay? Anyway, the answer is we're going to select E negative cross-match compatible unit. I hope that makes sense. Now, don't forget that in blood banking, we have clinical significant antibody, we have non-clinical significant antibody. I've already explained this many times on my video, but let me just add a little thing here. Just remember that most times we must do something about any antibody that are clinically significant, and it may interest you to know that antibody big E is a clinically significant antibody, and that is why it's important that once someone has developed that anti-big E allo antibody, we'll make sure that we'll give antigen big E negative, because it then means that the patient does not have the antigen big E. That was why the patient developed that allo anti-big E. Therefore, you must select a donor red cells that is lacking, that does not have antigen big E. I hope that makes sense. So just to bring this into context, a patient has an anti-big E allo antibody, what blood should be selected? The answer is B, which is you must select antigen big E negative cross-match compatible unit, okay? So, all right, thank you so much for listening. I hope this is well explained, okay? The reason why I expand this is that I want us to have a perfect understanding of what we are doing in the lab. It's not just enough to do the activities, we must understand what those activities actually implies or mean. Anyway, do let me know what you think about the video. Can I ask you to share, like, subscribe, and comment? That is the least thing you can do for this YouTube channel. Comment, like, share, and subscribe it to anyone that you think that share it to anyone you think that this video will benefit. And of course, if you are already working and you have experience and you think that there is something that can benefit someone, you know, from this video that maybe I forgot to mention, please feel free as well to put it on the comment section. Anyway, I wish you all the best. If you are preparing for your exam or you're preparing for your interview, I sincerely wish you all the best till I come back your way again. All right. Ta-ra. Bye.